Hey, my name is James Charpentier, and welcome back to Less Than 3%, where we talk about healthcare, my journey to become a physician, and really anything from the perspective of a black male pursuing medicine. And in this episode, there's definitely something interesting that I want to talk about, so stay tuned. One of the most important parts of healthcare, especially for physicians, is communication. Really, any aspect of patient care is going to have some aspect of communication in it. Really specifically, doctors being able to communicate and have conversations with their patients, which is ultimately how people are able to get treated effectively and get to better health outcomes. Now, the way that communication happens is just as important. If a physician isn't able to really effectively communicate with their patients, they're not really going to be able to help them reach the outcomes that they want to reach. And in this episode, we're going to talk quite a bit about that aspect of healthcare. So this episode is really going to discuss the importance of something called motivational interviewing and its impact on healthcare and health outcomes. So in this episode, we're going to try to address a couple of questions. First of all, what is motivational interviewing? What makes it different? Does it work? Is it effective? And what does the shift towards this method mean for the future of healthcare? So to get into it, I first want to define what motivational interviewing is. So this is a form of interviewing that goes on from the perspective of the physician in communicating with their patients. But this sort of interviewing, in terms of being able to ask questions about history and past medical conditions and all of these different things, is specifically geared towards being able to really engage the patient in conversations. So the idea behind this is it allows patients to have a lot more self-efficacy. They're really able to speak for themselves and really be involved in achieving healthier outcomes, to where it's not just the physician speaking to the patient and telling them what they need to do and making sure they're on the medication and all these different things, but there's really more of a partnership that's going on between the physician and the patient. And one of the things that I found really helpful in being able to define this is a paper that was put together by Mint on their website. Mint stands for the Motivational Interviewing Network of Trainers, and they kind of give a bit of a summary about motivational interviewing and what exactly it is. To quote, motivational interviewing is a guiding style of communication that sits between following, or good listening, active listening, and directing, which is actually giving advice and information. It's designed to empower people to change by having them draw out their own meaning, importance, and capacity for change. So ultimately, the physician is really looking at the things that matter to the patient, what their long-term goals are for their health, the different values that they have in their lives, and the different things that really help shape where they're at in their lives. Reading this actually really made me think about the sort of physician that I want to be for sure. And I definitely want to be someone that's not just simply giving out rules to someone or that sort of thing, but really be able to have conversations with people, really being able to see their perspective on things, see where they're coming from, see their background, and just really be able to connect with them and have conversations so that we can actually work together as a team. One thing I definitely want to hope to do is to be able to relate to my patients, whether it's being able to give them advice that may have helped me in certain areas, and really just being able to connect with people and recognize that they're seen and heard as people. And so to continue with that quote, motivational interviewing is based on a respectful and curious way of being with people that facilitates the natural process of change and honors client autonomy. And so I think really having something that helps to promote a patient's self-efficacy, that helps to allow someone to really be heard as a person is really something that all of us would want from the perspective of a patient. And after kind of defining that, what exactly makes it different? Because I'm mentioning this entire motivational interviewing thing, but I think a lot of us may be aware of the communication that usually goes on between a physician and a patient. So what exactly makes motivational interviewing different from the usual traditional models of interviewing patients? And that really gets into a lot of that aspect of self-efficacy. And so one thing I would say is that even something that I've learned throughout my education so far as a student, there's not always a lot of focus, especially from the physician's perspective, on really looking at the patient or really allowing the patient to speak for themselves and really seeking to make sure the patients are really aware of their autonomy when it comes to their treatment. And one example I would probably give would be a lot of times in the traditional model, what can happen is it's more so focused on the physician just telling the patient what they need to do better and how to improve this sort of outcome and what behavioral changes need to happen. Whereas in motivational interviewing, what often happens is it's flipped. And instead, the physician is focused on perhaps asking the patient, hey, like, what do you think you can do to be able to improve this area? Or what's your perspective on this sort of process? It's really focusing in more on the patient and allowing it to really be patient-centered, as opposed to everything kind of being more centered around the physician. So the paper I want to take a look at right now really highlights what the differences are in effectiveness when it comes to motivational interviewing based training versus just traditional training. And I thought this can really be helpful. So this was published in the Public Health Journal. It's titled Motivational Interviewing Based Training versus Traditional Training on the Uptake of Cervical Screening, a quasi-experimental study. And so what this study really took a look at was cervical cancer being an example of looking at motivational interviewing and its effects. And so one thing that it did was it looked at ultimately patients' compliance with cervical cancer screening tests and looked at which style of interviewing helped to really facilitate these patients getting that cervical cancer screening. And so just to do a quick rundown of the study, it was conducted in 2017 among 134 teachers. Participants were selected from these individuals and they were divided into motivational interviewing based training groups and then traditional based training groups. After going through a 3-session training program and 20 weeks after the end of the last training session, they looked at information obtained from cervical cancer screening tests. An important factor that they found at the end was that 20 weeks after this intervention, almost 21% of the group that was listed as motivational interviewing based training underwent this pap smear screening test, whereas only 9% of the women that received this traditional training actually wanted to go and take this test. So they conclude that motivational interviewing based training can have a significant positive effect on women's compliance with cervical cancer screening tests. Therefore, it's recommended that this technique should be adopted in women's health centers. So this is just a quick example of how motivational interviewing can really have an effect on patients being willing to comply when it comes to different things that are going on and different procedures. And so it really just goes back to when really pushing motivational interviewing, patients may be a lot more likely to really just feel that they have a lot more autonomy in the treatment. And so this can definitely lead to patients really being willing to listen a lot better to their physicians when it comes to a variety of issues. Now, let's see. There's another paper I want to take a look at in terms of really looking at how does motivational interviewing work. Another paper that I really think would help for taking a look at just how well motivational interviewing can work is a paper that was published in the British Journal of General Practice. It's titled Motivational Interviewing, a Systematic Review and Meta-Analysis. And just to do a very quick overview of the study, what they really just looked at was how well motivational interviewing can work in terms of being an intervention strategy in treatment of lifestyle problems and disease. And what they found as a result was that meta-analysis showed a significant effect for motivational interviewing on estimates for factors like BMI, total blood cholesterol, systolic blood pressure, alcohol concentration, and just things like that. So this just really gives another example of how motivational interviewing can have a positive effect on patient care. So with that being said, the next question is, what does this shift actually mean for the future of healthcare? Where is this whole shift towards motivational interviewing actually going? What impact is it having? And for that, I want to take a look at one more paper put together by Dr. N. Nicole Jacobs and a number of other researchers, which is titled Motivational Interviewing Training, a case-based curriculum for preclinical medical students. And so one thing I just really want to show is that motivational interviewing is really something that's taken medical schools by storm. One thing that they mention in here is that a training pack, and one thing that they mention in here based off of a study that they mention in this paper is that, as they quote, a training package to teach preclinical medical students about MI was effective in helping students learn the knowledge and skills necessary to deliver MI in a broad range of clinical cases. And so as this entire thing has shifted more and more towards schooling, it's definitely had a positive impact on students who are looking to ultimately become future doctors, on really being able to engage with their patients in an effective way through motivational interviewing. And so I hope what a lot of people can get from this episode is just that really pay attention to the way you're looking to engage with patients, because medicine isn't just being able to learn a bunch of different things in the science realm and the medicine realm and just being able to deliver treatments, but you're also caring for people. And so we really want to make sure that the way we're able to communicate, the way that we're able to engage with patients is in a way that can ultimately be beneficial to our relationships with our patients as people and really help them to grow and improve as not just people with maybe certain diseases or illnesses or problems, but just as holistic people altogether. And with that being said, that really closes out this episode. I hope you enjoyed it.